Today we're covering diverticular disease. Diverticula are sac-like mucosal outpouchings that protrude from the GI tract. There are true diverticula and false diverticula. True diverticula contain all the layers of the area affected. So this includes the mucosa, submucosa, muscle layer, as well as the serosa. False diverticula, also known as pseudodiverticula, have the mucosa going through the muscular layer only, so it includes the mucosa, submucosa, and the muscular layer. A couple examples of true diverticula are typically esophageal diverticula, as well as Meckel's diverticula. Colonic diverticula are typically pseudo or false diverticula. They're going to produce symptoms by trapping of feces and becoming inflamed or infected with possible bleeding and or rupturing, depending on the presentation. Here's an example of diverticula via endoscopic examination. Diverticulosis is the presence of multiple diverticula in the colon, most probably resulting from a lifelong low-fiber diet. The majority of diverticula are asymptomatic, but there are cases in which they can become inflamed and or bleed. Diverticulosis can occur anywhere in the large bowel, but it commonly occurs in the sigmoid area. As for development, it's uncommon to see diverticulosis in people under 40 years of age, although incidence does rapidly increase with each passing year after a person hits 40 years of age and progresses with the aging process. Etiology for diverticulosis, a couple of items. Number one, the diverticula themselves are considered to be caused by an increased intraluminal pressure, and this leads to mucosal extrusion through the weakest points of the muscular layer of the bowel. And these areas are just adjacent to the intramural blood vessels. The other component for etiology is a common occurrence seen in patients with a low fiber diet. This leads to increased pressure being needed to move the low bulk stools through the colon. Now, as far as symptoms and signs in general, note we'll get into this area, symptoms and signs, more specifically as we move into diverticulitis. But in general, about 70% of diverticula are asymptomatic, and about 25% will become painfully inflamed, producing diverticulitis. Out of those that become inflamed, developing diverticulitis, about 15% of those cases will bleed painlessly. And it's probably due to the fact that there's erosion of the adjacent blood vessels being impacted by the feces that are within the diverticula. In general, diverticular bleeding is going to stop spontaneously in about 3/4 of these patients. Diagnosis of diverticulosis is completed by colonoscopy or barium enema. What you will find is that asymptomatic diverticula are usually going to be found incidentally during colonoscopies that are looking for causes of painless bleeding, especially in the elderly population. Here's an example of multiple diverticula found on barium enema. Now, as far as treatment goes, asymptomatic diverticula are not treated. If and or when a patient becomes symptomatic, treatment is going to be determined based on the patient's symptomatology. If there's the presence of the inflammation without a rupture, then typically pharmaceutical treatment will be implemented. With the presence of a rupture, surgery is indicated. Diverticulitis is defined as inflammation of a diverticulum. It can result in pus accumulation in the soft tissue of the bowel wall, perforations, that can then produce peritonitis, possible fistulas, as well as abscess formation. In general, we're going to find that diverticulitis tends to be most serious in the elderly population, and again, this is usually going to be found in the sigmoid colon. The etiology of diverticulitis. This occurs when a small perforation develops in a diverticulum. Through that perforation, intestinal bacteria is released. It's going to result in a localized inflammation. Symptoms and signs of diverticulitis. Number 1, we're looking at pain. It's typically going to be located in the left lower quadrant. The patient may describe it as being an intermittent type pain, a cramping pain. They may tell you they aren't really having pain, but the area is just tender. Another common symptom is constipation, and that's very common. Possible diarrhea. There may be alternating bouts of both diarrhea and/or constipation. Now, if you have that presentation, not only do we have to look at possible diverticulitis, we may have to look at ruling out irritable bowel syndrome as well, or IBS. Fever is another symptom, can also be a sign. And about 20% of patients will report occasional blood in their stool. In addition to this, symptoms can include possible nausea and/or vomiting that can develop. Okay, so in many ways, if you think about it, the symptoms with diverticulitis are very similar to appendicitis, except the pain is on the opposite side of the abdomen, and it tends to occur in an older population. Remember, we tend to see appendicitis in patients more commonly under 40 years of age. We tend to see diverticulitis commonly in patients over 60. Diagnosis of diverticulitis is by CT scan. Now let's talk treatment. Antibiotics is the major treatment protocol in about 80% of cases, along with dietary fiber and increasing water consumption. And a lot of times, increase in exercise will be recommended as well. On average, 30 minutes a day, 3 to 4 times a week. In the event there is perforation, surgery is another treatment module. Meckel's diverticulum. Meckel's diverticulum is a congenital anomaly. It is found in the distal ileum, and it's usually within 100 centimeters of the ileocecal valve. It represents the persistent proximal end of the yolk sac that sometimes becomes attached to the inside of the umbilicus. So when this tissue is biopsied, it most often contains gastric and pancreatic tissue. This is the most common diverticulum of the small bowel. Meckel's diverticulum can occur at any age, but most often presents in older children. This is a picture of a Meckel's diverticulum for you to review. Here's an additional picture of a Meckel's diverticulum. It's in the lower right-hand corner. So as far as symptoms and signs of Meckel's diverticulum, it's uncommon to have much in the way of symptoms. One of the challenges is that bleeding may actually occur along with signs and symptoms of a bowel obstruction and diverticulitis. Well, with the bleeding, it's usually going to be painless bleeding, but it's going to be very bright red and rectal. Well, the challenge with this is not something we typically see in children. To diagnose it, it's pretty difficult to definitively diagnose it because it has to be located. Once it is located, the treatment is surgical removal of the diverticulum. Here's an example of an illustration that is showing the resection of a Meckel's diverticulum. Once this is completed and the patient recovers, they typically have no other symptoms.